all know how important it is to be kind. We are all facing one challenge or another, and that act of kindness from a stranger or a friend or a colleague can go a long way in making you feel so much better. It is not different for an autistic child. They need more kindness that you can ever be able to afford. But I encourage you all to continue choosing kindness for autistic children, for anyone who's different. Kindly choose kindness, show them kindness wherever you can. Also, don't forget, continue sharing this on your social media platforms and continue liking and sharing, and your feedback on our social media platforms is really important. As we all understand, one of the issues that autistic children struggle with is communication, and that is why our guest today is a speech therapist. He is going to take us through this very murky waters about speech and how it affects children with autism. I can't wait to learn what he has to share with us. And, you know, let's do this. So finally, Daktari, we get to have you on one of our episodes. Karibu sana.
Thank you very much for this opportunity so that we may share.
You are very welcome. So kindly start by introducing yourself.
Well, thank you for this opportunity. My name is Eric Sianyo. I'm a speech and language pathologist based in Kisii hospital called Garax Medicare Center.
Okay, so briefly talk to us about speech. What is speech therapy? What does it entail?
Well, speech therapy is one of the rehabilitative science that deals with the issues of communication as a whole. Well, we are referred as speech therapists or speech pathologists, but we cover a lot as a communication as a whole. Communication, it entails issues of speech production, language use, and also even the behavior that goes hand in hand with the communication. So speech therapy is entailed to help be it children or even adults, those who have some defect in communication, be it the production of speech or the use of language as a whole. Yes.
So, Daktari, in your line of work, how often do you encounter autistic children?
Well, my caseload is full of children with autism. It's a new area that now at least we are happy so many people are aware of this condition. It's not a disease, but it's a condition that, and most of the patients that we normally see, it happens that they are children. Autism is an area that its cause is not clearly known, but there are several causes that are maybe supposedly that cause this condition. Though autism is still a field that requires a lot of research so that we may be aware of exactly what could be the cause and maybe now how we go along to try and help these children.
Well, Daktari, what are some of the signs to look out for in order to identify if a child has autism in regards to speech?
Well, the first thing we do whenever maybe we come across these children with communication disorders, and as I've said, majority are those with autism. So there are a number of areas that have some disorders or defects. And children with autism, most of the areas that are affected is the area of communication, behavior part of it, that is a social skills, and also we have a cognitive part of it. So these three areas are the mostly affected. Communication is affected in most children whereby they are not able. Some are not able even to utter a word. They are not able to produce sounds. And even those who are able to mention words here and there is no coherent, there is no consistency. Some are able to say even 2-3 words, but you realize sometimes they may not even respond when you need them to respond. But you can hear them say words here and there at their own time. So communication per se is affected. Then another issue is the behavioral issues. You realize that most of the kids with autism, they exhibit tantrums mostly. They are a little bit what we call hyperactive most of the time. And that is why now we need to work on them so that they are able to calm down, to be a little bit manageable. So they are easily distracted. Those are some of the behaviors you can see in them. And they have some what we call individualized interest. They have a particular interest on a given activity or given toys. You may find a child really so much interested in a certain activity or in a certain pattern. They want even to arrange things in a given pattern, which sometimes will tell you that there could be an issue here. So behavioral issues they have a long range. There are those who have issues with interacting with others. They like being alone, do their things aside. It's not easy for them to interact with other peers. So they have that personal interest that they are not able even to take turn and interact with others. There are a number of cases. Sometimes they like gazing. You may find other kids gazing most of the time, other fidgeting, because sometimes they have that disturbance of sensory. They don't have sensory control. You'll find them at times jump, scream. Those are part of behavioral issues. And mostly, out of experience, most of the kids I've interacted with, they have language problem. Communication, expression is their major issues. They may understand perfectly everything, whatever they want, whatever you are telling them, but now to express their needs becomes a challenge. So those are some of, there are a number of features you can see in them, but those are just some of notable ones. And that is why, as a therapist, we take time, we go through a thorough assessment to be sure that whatever defect the child is undergoing is really not autism or it's autism. We try to differentiate from a natural delay in terms of communication and development, and also if there is really a condition that is causing the delay in communication. So one thing that I would like us or anyone to note, that there is a difference between autism and there is a condition which is very similar called ADHD. ADHD in full, it means attention deficit and hyperactive disorder. These are another condition that has almost similar features with autism, though they are a bit different. Sometimes they co-occur. Sometimes we have ADHD co-occurring with this autism condition called autism. Behaviors are similar, yes.
So Dr. What can make you differentiate a child with ADHD and one with autism? What is that one thing that can actually set them apart?
Those children who experience ADHD, their major issues is that they are extremely hyperactive. They lack attention, what we call inattentiveness, and they're easily irritated, easily emotionally disturbed most of the time. But when it comes to issues of communication, at times they are able to communicate a little bit, if it's only ADHD. But at times, most of the time, you find that this ADHD, it co-occur. In other words, you find a child having ADHD together with autism. So something that makes it even a little bit challenging. But ADHD alone, it affects more on the issue of being overactive, what we call hyperactivity. Yes.
So Dr. in your line of work, you have encountered so many of these children. How effective can you say speech therapy has been for these children? And do you know any that have actually improved from, doing speech therapy?
In my area of experience, I actually began working with children with autism in the area of communication issues as early as 2011. And we've seen a number of cases, and men have really improved depending on the cause of autism and the level that autism is. Mostly we have levels and the type of autism. We have those who have mild autism, we have those who are moderate, severe, and now the extreme one, we call it profound. So major of those who have mild autism, they improve very much. But again, it depends on their age. Those kids who begin therapy as early as possible, some begin even as early as 2 years, 2.5, 3 years, 4 years, they tend to improve very fast compared to those who begin therapy at a later age, about 6 years, 7 years. Improvement is there, yes, but it's not as much as those who begin early. So when they undergo therapy, first of all, they are able now to with time, they are able to relax. In other words, we reduce the hyperactivity. A child learns now to be able to sit still, be able to follow instruction, and even copy. Sometimes you train them to copy sounds, how to produce sounds, and how to use 1, 2, 3 words, simple sentences, how to follow instruction. So with time, they copy that and they are able to gain a lot. Some even now join school and they are able to cope at school as we work on them. And there is a considerable and recommendable improvement in many of them that we have been able to handle.
Dr. We appreciate you for the work that you're doing, especially with the autistic community. Kindly look into that camera and say something to our viewers.
Our viewers out there, there is a lot that we can talk about autism, but what we encourage you is that let us embrace that early intervention. Let us always, whenever a parent or a caregiver, you realize that there is something that is not going well, that the child is not following a typical milestone development, please let us try to seek early intervention from our specialist. The earlier you begin, the better the improvement that we shall realize. Otherwise, let us keep on assisting our kids. We are found here in Kisii, a place called Galax. We also move all over to Kericho, to Kisumu, and you are always free to consult whenever there is need. Thank you very much.
So Dr. we really appreciate you for gracing this episode today. We know how busy you are. We know that your time is very important. So I am going to allow you to leave, and thank you very much for coming. And it was a pleasure to have you, and I hope we can continue having this conversation. Thank you so much. So guys, I hope you're learning something from everything that we have been sharing so far, and I am going to open up my social media account so that you can slide in my DMs and ask questions, and let's have this conversation about autism, and also engage with us on every social media platform. Dazzling Center for Autism, all our hands are open for you guys. We cannot wait to engage with you. And the walk is on the 2nd of April, guys. Kindly show up for this amazing cause. Let's show up for these children. Let's show up for Dazzling Center for Autism. This is going to go a long way in helping us achieve the goal that we have set. We cannot wait to see you on the 2nd of April. I will personally be there, and a lot of other people that you know, and it would be amazing if you would be there too. And also, if you cannot be there but you know someone who would want to be engaged in this conversation, who would want to be there for the walk, kindly share this information with them, and keep sharing, keep commenting, keep saying something. Let us keep this information, this conversation about autism alive. I cannot wait to see you in the next episode. Goodbye.